Arthritis, it's more than just joint pain. It's a life-altering condition affecting over 350 million people worldwide. An umbrella term for over 100 disorders. Arthritis targets joints, cartilage, and connective tissues, leading to pain, stiffness, and reduced mobility. It affects people of all ages and often results in serious health complications. The most common types? Osteoarthritis affects 15% of the global population over 30. And rheumatoid arthritis, an autoimmune type, impacting around 18 million people worldwide. Medications can make a big difference, but often come with unwanted side effects. Is there a more natural way to manage symptoms, ease pain, and support joint health? For thousands of years, Chinese medicine has been a powerful ally in joint health, viewing joint issues as imbalances in the body, promoting long-term well-being by addressing root causes while relieving symptoms. Though research is still evolving and faces challenges with design and funding limitations, an increasing number of studies highlight Chinese medicine as a safe and effective complement to conventional treatments, providing symptom relief, immune support, and inflammation control, often with fewer side effects. So, let's take a look at what the evidence shows. A 2020 review published in Pain Research and Management looked at 44 clinical trials involving over 4,000 osteoarthritis patients, 2012 using Chinese medicine and 2002 on standard Western treatments. Here's what it found. Total effective rate: over 68% of patients treated with Chinese medicine reported improvements, far outpacing those using only Western treatments. Acupuncture alone improved effectiveness by nearly 4 times. Mobility improvement. Chinese medicine improved joint function by around 10.5 points on the WOMAC scale, which tracks arthritis symptoms. Acupuncture alone boosted joint movement and flexibility by 23%. Inflammation control. TCM treatments, especially herbal formulas and topical applications, reduced inflammation markers like Illinois 1 and TNF by 11 and 15 points respectively. Lower inflammation means less pain and better joint health. But it's not just short-term relief. The review also showed a lower rate of symptom recurrence, suggesting it may help manage arthritis symptoms longer than conventional options alone. Another 2023 meta-analysis in Aging Research Reviews looked at 2,362 knee osteoarthritis patients and found acupuncture reduced pain by up to 30%. The study suggests acupuncture activates the body's natural pain relief mechanisms and boosts blood flow, helping to reduce inflammation and stiffness. The same study also highlighted the effectiveness of herbal medicine. Herbs like turmeric and licorice, known for their anti-inflammatory properties, are commonly used in Chinese medicine formulas. These herbs not only ease joint pain and stiffness, but also help regulate immune responses, which is especially beneficial for autoimmune conditions like rheumatoid arthritis. And there are some standout formulas too. ZQFTN tablets, Jingqing Feng Tongning, and TGP capsules, total glucosides of peony, have caught attention for their effectiveness. A 2019 study in engineering found ZQFTN tablets worked for 85% of rheumatoid arthritis patients in over 5,000 cases. When paired with standard drugs like methotrexate, MTX, they enhanced symptom relief and reduced side effects. Chinese medicine is proving to be a valuable ally in managing arthritis. While more research is needed, the current evidence suggests it can play an essential role in pain relief, inflammation control, and improving mobility. Managing arthritis is a journey, and the right support can make all the difference. If you're exploring natural options, Chinese medicine might offer the extra support you're looking for. For personalized guidance, consult a licensed Chinese medicine practitioner, or if you're in London, stop by Acumedic for expert care. This video is brought to you by Acumedic in London. If you found this video helpful, don't forget to like, subscribe, and share this video with someone who might benefit. Thanks for watching, and see you next time.